Good morning. I am really excited to share some preliminary evidence from my NIA-funded KO1 award on social support and mental health. Older women living with HIV experience intersectional and internalized stigma in the United States and worldwide. As a result of multiple marginalized social identities and gender-based double standards, they often experience guilt, self-blame, and shame, which as a result increases their risk of social isolation, loneliness, and poor mental health. However, we know that supportive social relationships can mitigate these negative effects and result in more positive psychological and behavioral outcomes. We also know that social relations are multidimensional and can refer to social network structure, support function, or quality or adequacy of relationships. So this study leverages this complexity of social relationships to examine the implications of different dimensions of support networks on both depressive symptoms and loneliness. So specifically, I look at both emotional support and instrumental support in terms of support perceptions and adequacy of received support. So to address these study aims, I designed the Care Resources in Older Women's Networks, or CROWN study. Data collection is currently ongoing, but these data represent an initial sample of 74 participants. They were cisgender women over age 50 who identified as Black or Latina. And during the interview, they completed a very detailed social network assessment and a psychosocial survey. So the measures of support and support adequacy were both single item. In the past year, how much support did you receive? And in the past year, how much support did you need? And so controlling
Can
for...
you come to your conclusion?
Sorry. Controlling for depressive symptomology, perceived emotional support was significantly associated with lower depressive symptomology. If you're interested in the loneliness, please, I invite you to come to my poster. Thank you.
Okay, thank you.